The C-section is a surgery performed to deliver the baby and remove the placenta and chorioamniotic sac from the mother's uterus. The rate of C-sections worldwide is increasing due to certain difficulties in the healthcare system that prevent the respect of the biological and psychological time of women in labor. Mothers request, as an independent decision, or due to misinformation and the mistrust of some health professionals and some pregnant women regarding their ability to dilate, push, and cope with the pain of labor. When there's a medical indication, based on reasons of the health of the mother and/or fetus, C-sections are less risky than vaginal births. Cesarean deliveries are performed in an operating room, where usually there are obstetricians or obstetrician gynecologists, an anesthesiologist, at least one surgical technician, and nursing staff. According to respectful childbirth guidelines, women have the right to be accompanied during the procedure by the person of their choice. Generally, epidural or spinal anesthesia is used, which prevents the woman from feeling pain from the waist to the feet. However, she usually feels the abdomen being touched during the procedure. In one arm, she has N4 placed to achieve dilatation and administer medication, depending on the evolution of her health conditions. Before the procedure, the woman's pubic hair is shaved, and the abdomen is disinfected with a sanitizing substance. A monitor is used to check the mother's blood pressure and heart rate, and a bladder catheter is usually placed. Sterile drapes are used to cover the area of surgery so that the woman and the person accompanying her cannot see the surgery because of the discomfort it may cause them. Doctors cut the abdominal wall and then the uterus. They remove the baby and wait a reasonable time to cut the umbilical cord. This is followed by the delivery of the placenta. If health conditions so permit, the baby should be brought to the mother so that she can see it and have a first contact. The uterus is then sutured with dissolvable stitches, as well as the abdominal wall. At the end of the surgery, a bandage is placed over the surgical wound. C-sections are classified into two main groups: planned and emergency. Planned ones are those whose cause is determined during pregnancy, before the onset of labor. The indication for emergency C-sections occurs during labor. Some examples of reasons for planned C-sections are placenta previa, that is, when the placenta blocks the internal cervical os. Severe alterations of the mother's pelvis, which have a very low incidence rate in the population. Active genital herpes, in other words, when there are overt sore close to the estimated date of delivery. Baby in a transverse lie inside the uterus, that is, across the uterus. And placenta accrete, a condition that implies an abnormally adherent placenta in the uterus. Some examples of emergency C-sections are placental abruption, eclampsia, which is a severe case of hypertension in pregnancy, and prolapsed umbilical cord, meaning that the cord drops through the cervix when the water has broken. In case of conditions such as cholestasis, hypertension, diabetes, premature rupture of membranes, previous C-sections, or fetal conditions, such as fetal growth restriction, the possibility of a vaginal delivery, or a C-section, should be evaluated on a case-by-case basis. It's important to remember that abdominal deliveries have saved many lives throughout history. But, being a major surgery, its excessive practice, with no health reasons to justify it, implies greater risks for the mother and the fetus. That's why it's essential that you get information and advice from your healthcare team, considering that each case is unique.